Hey friends, welcome back to Breathe Easy, where we do quick micro learning that actually helps at the bedside. Today we're talking about trach tube sizing, and I'm going to say it up front. A size 6 is not always a size 6. If you've ever grabbed the same size replacement and thought, why does this look totally different? You're not alone. Stick with me a few minutes and I'll give you a simple, safe way to think about trach sizing without getting lost in the numbers. The size number is just the headline. It's not the whole story. And what really matters are the measurements behind that number. This session's about shifting our mindset from label-based thinking to spec-based thinking. All right, so let's talk about why trach tube sizing actually matters. Because this isn't just numbers on plastic situation. Trach sizing is sneaky. It looks simple until it's not. And that little number on the flange gives us confidence, but it doesn't tell the whole story. Think about it. Airflow, comfort, ventilation, suctioning, speaking, even skin and tracheal health are all tied in how that tube fits. And fit is way more than just the size label. Inner diameter affects how hard the patient has to work to breathe and whether your suction catheter or bronchoscope even fits. Outer diameter, that's how much real estate that tube takes up in the trachea, and that matters for comfort, swallowing, and irritation. Then you add length, curvature, cuff design, and suddenly two tubes with the same size number can behave totally different. And here's where it really hits home for us respiratory therapists. Tube exchanges are high-risk moments. If we assume two tubes are equivalent just because the number matches, then we run into air leaks, poor ventilation, reinsertion issues, or that awful, why does this not feel right moment at the bedside. The good news, this doesn't have to be complicated. The goal of this isn't to make you memorize specs, it's to help you build mental framework so you know what to check, what questions to ask, and when to pause before assuming a tube is truly the same. If you walk away with one thing from this, trach sizing is a safety skill, not just a number. And a few extra seconds of verification can make a huge difference for your patient. This is where we pause and reset what size actually means. We're moving beyond the label and looking at the full picture of how a tube behaves in the airway. One of the most important concepts in trach tube management is the numerical size printed on the tube does not fully describe how the tube will behave in the airway. And true sizing depends on a combination of inner diameter, outer diameter, length, curvature, and cuff style. Inner diameter directly impacts airflow resistance and the ability to pass suction. Outer diameter determines how much space the tube occupies with the trachea and can influence comfort, swallowing, and risk of mucosal injury. Tube length affects where the distal tip sits with the trachea, which is particularly important in patients with thicker necks, altered anatomy, or prior airway surgery. Curvature influences how the tube aligns with the patient's airway, and cuff style affects sealing pressure, tracheal wall contact, and aspiration risk. Two tubes with the same label size may differ significantly in one or more of these characteristics, especially when comparing different brands or product lines. And this is why relying solely on the size number can be misleading. Respiratory therapists should consistently verify full tube specs and develop the habit of thinking beyond the label. Doing so improves troubleshooting during ventilation, enhances communication with providers, and supports safer tube exchanges when an equivalent replacement is needed. The good news, the information we need is usually right in front of us. We just have to slow down enough to look for it. When it comes to trach tube sizing, the information we need is almost always right there. We just forget to look for it in the middle of a busy shift. Manufacturers actually give us a lot of help. The packaging spells out key details like inner diameter, outer diameter, length, and cuff type, and that box is basically a mini cheat sheet for safe decision making. And if the box is already gone, no problem. Many of those same details are printed directly on the tube flange, and that little flange can be a lifesaver when you're troubleshooting ventilation, managing alarms, or preparing for a tube exchange. But let's talk about real life for a second. What if the numbers on the flange have rubbed off or are unreadable? This is where we pause and don't guess. Our Online Respiratory Handbook includes a tracheostomy sizing resource and comparison chart that can help identify things that are missing or don't seem to line up. It's designed to help support when brand labels, sizing systems, or documentation isn't really clear. So in these situations, it's also important to slow down, use available references, communicate early, especially before a tube exchange or escalation. When something feels off, that you're on cue to double check and bring in support rather than relying on your assumptions. Taking a few seconds to check the packaging, the flange, and handbook resources helps ensure the tube you're working with truly matches what the patient has, rather than what we think it is. This is especially important for therapists who float between units or work across different facilities where brands and models can change. By consistently using these built-in safety checks, we have more confident decisions, reduce risk in high-stress moments, and ensure our tube choices truly match the patient's anatomy and clinical goals. Bottom line, when labels are missing, the answer isn't guessing, it's using the tools and resources already built to support you. Let's talk about one big source of confusion, the sizing system. Before we talk about choosing or exchanging a trach tube, we need to speak the same sizing language because not all sizes mean the same thing. In fact, there are two different sizing systems in use, and mixing them up is a common source of trouble. First up is Jackson sizing, and this system is used only for the shyly flexible tracheostomy tubes. And here's the key thing to remember. A Jackson size is not a physical measurement. It doesn't tell you the inner diameter or the outer diameter. It also more works like the model name. So a size 6 in a Jackson doesn't actually describe how big the tube is. Now let's contrast that with IOS sizing, which is used for the shyly XLT tubes and most other manufacturers like Vivona, Traco, Portex. ISO sizing is based on the inner diameter of the tube, but one important nuance, whether that measurement includes an inner cannula, can vary by manufacturer, so details still matter. Why does this matter so much? Because having two sizing systems side by side creates real potential for confusion, especially during a tube exchange. Two tubes with the same size number can actually be very different in their dimensions depending on which system is being used. This is why it's important to pause, identify the sizing system before you assume tubes are interchangeable across brands. Recognizing this difference helps us make safer comparisons, avoid inappropriate tube selection, and reduce risk whether we're planning a routine exchange or responding in an urgent situation. Diameter gets most of the attention, but length and cuff style are just as important. So far, we've talked a lot about the diameter, but the trach sizing doesn't stop there. Length and cuff style matter just as much, and sometimes even more. Let's start with the tube length. Length determines where the tip of the trach actually sits in the trachea, and that positioning is critical. Patients with obesity, neck edema, usually anatomy, or tracheal pathology often need more standard length tube, and that's where longer options like Shyly XLTs or Vivona adjustable flange tubes come into play. These tubes are designed to accommodate anatomy differences and help keep the tube exactly where it needs to be. So let's talk cuffs, because not all cuffs have the same way. High volume, low pressure cuffs are designed to spread pressure evenly across the tracheal wall. Taper cuffs may help reduce microaspiration. Water-filled cuffs and foam cuffs act very differently and are often chosen for specific clinical situations. In other words, cuff choice isn't random, and it definitely isn't a one-size-fits-all. This becomes especially important when downsizing or exchanging specialized tubes. Even if the diameter looks right, the replacement tube still has to be long enough and have the right cuff design for the patient. And if we miss that step, we can run into cuff leaks, ventilation problems, or increased risk of mucosal injury. So by paying attention to the tube length and cuff style, not just the numbers, we can anticipate some problems before they even happen and advocate for the best tube choice alongside the care team. It's one more way respiratory therapists can help keep airways safe, functional, and patient-centered. This is where we bring everything together for a real-world practice. This chart helps us compare tubes on outer diameter and length, not just the size label. It's especially helpful when the original brand isn't available. This chart isn't perfect, but it gives us a structured, safer starting point in clinical decision making across standard Shyly flexible trach tubes, Tracos, Portex, and standard Vivona tubes. Now let's pause because pediatric and neonatal trachs are a completely different world. In kids, we're often dealing with custom tubes or TTS designs, which means the usual same size, same tube logic really doesn't apply. Here's the big takeaway. Even if the inner diameter matches, the length may not, and in a small way, a few millimeters makes a huge difference. Before any exchange, planned or urgent, take a moment to measure and compare the length of the current tube and the replacement. A tube too short can compromise airway security. Tube too long can cause irritation and positioning issues. So when it comes to pediatric and neonatal trachs, remember length matters just as much as diameter, and sometimes even more. The extra check is a safety step, not a delay. So let's wrap this up. When it comes to tracheostomy tube management, safety starts by being intentional. Before making any assumptions, we need to confirm which sizing system we're working with, then verify the actual tube dimensions using both the packaging and flange. These 2 quick checks can prevent a whole lot of trouble, also utilizing our resources. When a tube exchange is needed, especially when switching brands, the adult comparison chart can be a helpful starting point. But remember, it's a guide, not even a shortcut. Every tube still needs to be checked for diameter, length, and cuff design before it goes anywhere near the patient. This step is especially critical when downsizing or exchanging extended length or custom trach tubes, where losing the length can actually turn into ventilation problems. And if something doesn't feel right, speak up. Clear communication with respiratory care leaders and attending providers is key when there's uncertainty. These conversations protect our patients and they protect us. By consistently applying these principles, we reduce variability, improve patient safety, and walk into high-risk airway moments with more confidence. Thoughtful sizing decisions lead to better ventilation, fewer complications, and safer care for patients with tracheostomies. So same tube? Maybe. Same fit? Only if you check. And that's how we help everyone breathe easy.